So thank you again, Dr. Cho, for coming. We're so honored to have you and to learn about all the efforts you have been making to ensure that our community is safe and to educate and make sure that there is equity as we challenge this pandemic. For our audience members, he has quite a resume, so please hang on while I review it. And I think it's important for you to know the many things that this man has done to contribute to making our society healthier. The Florida Department of Health announced Dr. Yuli Cho as the new director of the Florida Department of Health in Pinellas County. However, since May of 2013, he served as the director of the Florida Department of Health in Polk County. Dr. Cho is a committed medical professional with an extensive history in public health, and that's according to his Deputy Secretary for County Health Systems, Kim Barnhill. His experience, according to Ms. Barnhill, in serving the medical, academic, and community health arenas makes him a tremendous asset to the department and the people of Pinellas County. In November 2012, Dr. Cho was named interim director of the Florida Department of Health in Polk, and in May of 2013, he transitioned to the director. He is board certified in both internal medicine and infectious diseases, and is currently an assistant professor at the University of South Florida Morsani College of Medicine in the Department of Internal Medicine, Division of Infectious Disease, and International Medicine. Dr. Cho also serves as the director of the Hardee County Health Department. He's a proud graduate of the University of Florida, where he earned a bachelor's degree in microbiology. He also earned a doctorate in osteopathic medicine from Nova Southeastern University in 2005. And Dr. Cho completed his internal medicine residency and infectious diseases fellowship at the University of Florida in 2011. Dr. Cho accepted the position of assistant professor of medicine with the Division of Infectious Disease and International Medicine at USF, and currently serves as the co-chair of the Health and Medical Committee for the 8-county Tampa Bay Regional Domestic Security Task Force, as well as vice chair of the Health and Medical Coalition. He also serves as the co-chair of the statewide Communicable Disease Program Council and sits on a number of executive boards and committees for local professional and community organizations, including the Polk County Medical Association, United Way, and Polk Vision. We are certainly grateful to have him today. We have an expertise that we can't quantify, and we look forward to this robust conversation.
Appreciate it. Good morning, everybody, and thank you for having me. And thank you for allowing me to participate in this important conversation. Obviously, from a public health standpoint for this past year, we've really been tackling and trying to address COVID-19. This has been a once in a lifetime, once in a century pandemic, something I think they'll write about for years to come. But today with this group, I'd like to examine sort of the health equity aspect of in the setting of COVID-19 vaccinations, and then pivot into sort of talking about some of the solutions to tackle these more systemic issues through health and all policies. So with that, I'd like to start off with a little background on COVID-19. I'm sure with everyone sort of following this along over the past year and a half, you probably know this information just as well as I do. In terms of the history, in terms of the background, this all started when it was first discovered in Wuhan, China, back in December of 2019. The coronavirus does have that typical crown spike protein appearance. Those projections where we use to target the vaccines. It's a respiratory virus, so it transmits directly from person to person via respiratory droplets. And some of the key symptoms includes dry cough, shortness of breath, loss of taste or smell, sore throat, among other slew of other symptoms. So when it was first discovered, again, in December of 2019, it did spread, and we did watch it spread to Europe, and most notably in Italy, then having the first case in the US in January of 2020, and our first case in Florida in early March. And since that time, the World Health Organization has declared it a worldwide pandemic. In the state of Florida, we've been equally impacted. And to date, through the pandemic, we've had over 2.2 million cases. resulting in over 89,000 or close to 90,000 hospitalizations and close to 35,000 deaths. So a tremendous impact to both Florida as well as the country. You can see the peaks, and people have spoken about multiple peaks throughout this pandemic. Starting with in March, we did see a small peak when it first started. We saw a larger peak in the summer of last year, and then into the winter and or the beginning of 2021 as well, seeing that last peak. We did start to see a fourth peak, and you can sort of see it at the tail end on the right hand of the screen. But fortunately for us, and it is now going back down, and hopefully it'll continue to maintain that course of that downward trajectory. And I think a lot of that is probably due to our vaccination efforts. So in terms of our cases over the pandemic, cumulatively, we've had over 78,000 cases here in Pinellas. What we did do follow on a day-to-day basis is to take the 7-day average. It accounts from the day-to-day variations in terms of testing, in terms of reporting. That number is currently at 180 cases per day, which has been an improvement compared to the last 2 weeks. Similarly, we do monitor the percent positivity. That's the percent in a given day of tests that come back positive. Again, a 7-day rolling average is at 4.9%. And if you recall that from World Health Organizations, that target is generally as low as possible, but at least less than 5%. So hopefully it'll continue this downward somewhat trajectory. Now, in terms of deaths, we've seen over this time span close to 1,600 deaths. The largest impacted age group was those older than the age of 65, which accounted for 87% of the deaths. And keep in mind that in Pinellas County, we are particularly vulnerable because we do have that older age population. Similarly, we do have a significant number of long-term care residents as well, probably one of the largest in the state, and which accounted for 56% of the deaths. Our case fatality rate, and that's the deaths per known cases of COVID, is at 2.1%. So from a health equity standpoint, you can see the disproportionate impact in our communities of color. Now, looking at the cases, you can see that our Black population accounted for 13% of the cases, and keep in mind our general population is about 11%. For hospitalization, even more significant was at 8% overall throughout this course of the pandemic, and deaths being at about 11%. Similarly, and I didn't really get into this as much as Dr. Stephanie Reed and Tim Dutton last month did cover this a little bit more in detail. But the rates were significant in our Black and Brown communities. And they touched on it as well due to several factors, really bleeding into the social determinants of health, that our communities of color do have a higher proportion of the population on front line, so more exposures. And at the same time, there is a disproportionate burden of chronic diseases, which can result in more severe outcomes, chronic health conditions like heart disease and diabetes, among other things that could, again, lead to those hospitalizations and those deaths. And let's not underscore the impact that COVID had and as a society, as a community. People have minimized sort of the impact, but in 2020, COVID-19 it was the third most common cause of death behind heart disease and cancers. In fact, it decreased our life expectancy by years. So to have that kind of tremendous impact on our mortality rates is just significant. This has been huge. It's been trying for some of those responders, a lot of the healthcare professionals, and us as well as the larger community. The impact of COVID, I just cannot underscore that enough. In terms of the case fatality rate, again, worldwide, it was at 2.3%. Florida is 1.6%. As I mentioned earlier, it's a little higher in Pinellas, again, with our larger, older population at 2.1%. However, that number is probably a little less when you account for, you've probably heard the asymptomatic types of infections, those that don't go in for testing, and it's the overall fatality rate, the infection fatality rate is estimated to be less than 1%, which is good. And not all of it's directly related to COVID. There's certainly a lot of indirect effects, such as the delayed care and overburdened healthcare system, as well as mental health issues, as our opioid overdose have also skyrocketed around the same time span. What we found and what's concerning for us in the state of Florida, we've seen 16.5% higher all-cause mortality than what we've seen over the last 3-year average. Obviously, the biggest driver of all of this was COVID-19. So what leads to severe disease, hospitalizations, and deaths? The age, older than 65, had a disproportionate impact. Those with severe comorbid conditions, heart disease, diabetes, lung disease, obesity, smoking, among others. This virus in itself has been challenging. One of the more recent challenges is some of the variants that you've probably seen about, read about, that this COVID-19 is an RNA virus. They have a tendency to mutate pretty routinely. It's sort of common to do so. A lot of those mutations are insignificant. However, it can confer also mutations in that it can make it more transmissible, more infectious to individuals. It can also confer resistance to antibiotics. And so these are some of the things that we're watching. In the state of Florida, we have now discovered over 9,200 variants, the majority of which is the UK variant that you see on the second one. It's the B117. It is more transmissible, meaning it's more readily spread to other individuals. But the good news is the vaccines are still effective against this strain. It's the other variants that is a little bit more concerning. And if we do see a proliferation of these other variants that are out there, most notably the South African, Brazilian, as well as the California strains, these do have less activity with the vaccine, i.e. the vaccine is less effective against these variants. And if we do see an increase of that, how would it confer other future outbreaks? And that is something that we're monitoring very closely on a day-to-day basis. So with COVID-19 really throughout the pandemic, we've really seen science in action. We've learned a lot, but there's still a lot of unknowns. And even through the challenges of the pandemic, the country had to develop how to diagnose COVID. So there's now several tests that are available. There are treatments that are out there as well. Not as effective as I would have liked. The steroids are one of the mainstays for severe COVID, but they're continuing to try to discover more treatment options out there. The biggest thing, and something that our message really hasn't changed since the beginning, is that prevention piece. For virus, it includes masking, social distancing, hand washing, and most recently and most effectively, the vaccination efforts. Forward. I did want to give a little background on how the vaccination came about. There's been a lot of misinformation of the vaccine, but in general, as well as COVID in general. The vaccine came around due to the Operation Warp Speed program that was part of the Health and Human Services, including the CDC, NIH, among other organizations. The goal was to produce and deliver 300 million doses of vaccines that were safe and effective at a pretty rapid pace. Protocols demonstrating safety and efficacy were aligned to allow trials to proceed more quickly with federal government oversight. The federal government assumed the risks from a lot of the pharmaceutical companies, financial risk, and the phases of the vaccine did development occurred simultaneously. But the one concern that I've heard is that they don't trust the vaccine because of how fast it was developed. I can assure you that even though they used a term like Operation Warp Speed, they didn't cut there was no corners cut. Essentially, they used the same sort of testing and phases that they do for any other vaccines. They've utilized the same sample size, 30 to 40,000 each of the vaccines, to look at both the safety and efficacy. So they did the same steps that they did for the approval for any vaccines. So you can definitively say that these vaccines are safe and effective, and I would recommend it to anyone in the community, and certainly my family as well. The first vaccine that was approved was the Pfizer BioNTech vaccine. This is an mRNA vaccine. The mRNA vaccine in itself isn't a new technology, but it's the first time sort of broadly used. Really great technology that sort of is like a Trojan horse, get into the cells, help replicate that spike protein that I mentioned earlier to develop, so your body can develop those natural antibodies. It is a 2-dose vaccine series separated by 21 days apart. Some common side effects includes pain at the injection site, fatigue, and headache. These side effects are more common with the second dose, and if you're of younger age, of less than 55, studies did find that you did have more frequent of those common side effects. It did receive from the FDA an emergency use authorization on December 11th for individuals older than the age of 16. So what did the studies show? It did do a pretty effective job on preventing symptomatic COVID-19. The overall efficacy was 95%. The question also remains, since it is a relatively new vaccine, is how long does that protection last? That is to be determined, hopefully at least a year or two, but time will tell whether we'll need a booster subsequently, or it's going to be like the flu shot where you do get one on an annual basis. I'm not going to go through this whole slide, but I do want to mention with some of the studies, they did have a good representation both racially as well as in terms of age, and what they found in terms of both those demographics and also with comorbid conditions is that it was equally efficacious as well as safe among various ages and other demographic groups. Our second vaccine that was introduced and approved was the Moderna vaccine. Similar to the Pfizer vaccine, it was also an mRNA-based vaccine. And again, it codes again for that spike protein. It is also a 2-dose vaccine separated by 28 days apart. Similar side effect profile, including pain at the injection site, fatigue, and headache. More common with the second dose, it received its EUA approval on December 18th for individuals over the age of 18. A little bit about the study. Overall, it was found to be 95% effective, 100% effective against severe infections, those requiring hospitalizations. And really, and ultimately, that's what you really want from a vaccine. It's not necessarily preventing infections or disease, it's that severe outcomes. And certainly these vaccines have demonstrated the ability that it does prevent those severe outcomes from COVID-19. Again, similar to Pfizer vaccine, looking at the longevity and how long those antibody and that protection lasts. As I mentioned earlier, they're looking at, there are concerns of some of the variants that are out there. So Moderna is testing right now a booster shot against some of those variants out there, most notably the South African variant. Similar to the Pfizer vaccine, they did try to get a good representation based on age, race, comorbidities, ethnic groups, as well as occupations. And again, throughout these groups, they did find equal effectiveness as well as equal safety profiles. And then lastly, the Johnson & Johnson Janssen vaccine. This is an adenovirus vector, meaning that it acts like a Trojan horse where they come into the cells and encodes for, again, that spike protein. It's the only one that's been approved for a 1-dose vaccine. Most common side effects equals pain at the injection site, headache, and fatigue. It did receive initially its first EUA approval on February 26 for individuals older than the age of 18. You've probably all heard that it was paused due to rare blood clots that were noted, mainly in women between the ages of 18 and in their 40s. The FDA did, through their advisory group, did study some of that data that is out there. They deemed that these rare blood clots, it did get a warning on their label, but they felt like the benefits outweighed the risks, and they restarted the vaccine just recently on April 23rd. Similar in terms of the efficacy, a little lower than compared to mRNA vaccines, but 67%. It was 100% effective, and again, that's the key thing that you want with these vaccines is requiring those severe or preventing those severe outcomes. Studies did even look at asymptomatic prevention, and they found to be 47% effective after 29 days. Here's a nice summary of the vaccine, 3 vaccines that are currently approved in the US, as well as their efficacy. So I'm going to skip through this one. With the vaccines, I think one of the next challenges was how to best distribute the vaccines. Through collaboration and community partnerships, we've developed a robust vaccination distributions sort of sites that are out there. We've developed, working predominantly with the fire EMS as well as emergency management, developed these community vaccination sites located at the Health Equity, Center for Health Equity, the Pinellas Park Performing Arts Center, as well as Central Pinellas and Largo. We have been offering over 20,000 doses per week. That is first and second doses. The state did also open a site at the Clearwater YMCA. And through the last few months, a lot of the pharmacies have come online to offer the vaccines, really at all the major pharmacy retailers here in Pinellas County. Additionally, medical providers, including hospitals, community centers of Pinellas, among other groups, have also offered the vaccines. We've done special missions for homebound individuals, homeless, as well as some of the senior communities that are out there. So who's getting the vaccine? This is our vaccine data as of Monday. For Pinellas residents that have at least received 1 dose, we're at close to 42%, and those that completed the series was at 30%. For adults, those older than 18 in Pinellas County, we're at 49% that have received 1 dose, and completed the series about 35.6%. And for our older population, our senior population, we're at 73%, and those that completed the series is at close to 62%. Looking at racial and ethnic breakdowns, so we can also appreciate the disparities in terms of the population vaccinated among those age groups that I mentioned, the total population, those older than the age of 18, and those older than the age of 65. And you can see that in terms of race, our Black population did have received a lower percentage in those 3 categories, age categories. So the disparity is certainly there. Similarly, we have seen that in our Latinx communities as well, that disproportionate uptake and administration of vaccine in our Black and Brown communities. So what is accounting for that? And again, I think a lot of this goes back to some of those social determinants of health. Some of those vaccines could be due to access issues, whether it's internet access, work schedule, where it's harder for our communities to go out there and take time off work, transportation issues, access to care or reliable information, talking to a physician and getting some medical advice. Locations could also be a factor. If you look at some of the pharmacies that are out there, there are deserts where either food deserts, but also pharmacy deserts where it's not necessarily situated in our communities of color. Additionally, Florida did implement an age-based rollout, and this speaks to probably another larger health equity issue, but we have less of our community of color represented in our senior community or senior age population. Black seniors account for only 5.4% of those older than the age of 65 in Pinellas, and our Hispanic seniors only account for 4.5%. So initially, when the focus was the 65 years of age, and that was the priority groups, there was just less representation, and especially in that initial group with the vaccine rollout. And certainly vaccine hesitancy does have is a key player for really the community at large, but also our communities of color. So we did recognize this disparate rollout as well as disparate uptake in our vaccines in our communities of color early on. We did develop a community equity vaccine work group comprised of community leaders, faith-based leaders, as well as organizations that serve our communities of color to help steer and how to do special missions and outreaches and education to our community. We review the data as to where we can best target some of our activities. We started education campaigns on vaccine hesitancy, did panel discussions to really try to dispel some of the misconceptions of the COVID vaccine out there. Other organizations have stepped up, such as the Foundation for Healthy St. Petersburg, developing the Beat COVID Pinellas initiative through messaging, as well as a Navigator program going door to door to try to get people to these community vaccination sites. We work with libraries to serve as access points to get into the system and register for a vaccine. We've partnered with the Pinellas County Urban League, as well as Infinity Consultants for homebound mission programs. And to date, and due to the efforts of this group, we have completed 31 missions and vaccinated over 70,000 individuals through this particular initiative. So I'm really proud of some of the efforts. These are some of the pictures from our health equity missions, and we'll hopefully continue to do these programs as the demand persists. But unfortunately, what we are seeing in both those missions as well as our community at large is the drop in demand, significant drop in demand, especially in the past year, week and a half, where we have hundreds and hundreds of slots in our community sites that are going unfilled. In fact, and unfortunately to me, is that that we are looking to even consolidate sites. We're looking at shifting priorities, strategies to more of the private sector, since the pharmacies themselves are having trouble getting people to get vaccinated. According to most efforts, in order to really get past the pandemic, that we need to achieve a herd immunity about 70 to 75% or 85% in that range to have that community level protection. And just with this drop off, my concern is that we may not get to that point. So hopefully something that we encourage folks to look at, talk to their providers, to their physicians, talk to somebody they know. With 50% of individuals gotten vaccinated, you probably know a friend or family that went and got the vaccines. I encourage individuals to talk to your friends and ask them how they came to that decision, what their experience was, what their concerns are. So I want to continue to push the importance of getting that vaccine. So something that we will continue to do throughout the remainder of this pandemic. I'm going to sort of shift topics in that, but and I'm going to demonstrate that it is related. Now, if you look at some of the COVID-19 cases by zip code in Pinellas, you can see some of the zip codes that were more highly impacted here on this map. And I want to next shift to zip codes by diabetes deaths in Pinellas. On the left is those older than the age of 65. On the right, it's under the age of 65. The darker shade purple and orange here has higher zip code or higher deaths, rates of deaths in those particular zip codes. You can see that overlap from some of the previous slide as well with the COVID cases. And similar with the cancer deaths, you can see, again, you can start seeing that overlap with some of the same zip codes that are more impacted by COVID, by diabetes, by cancers. Similarly, with the cardiovascular death, you can see, again, some of the same overlapping zip codes as well. I show these zip codes, these maps, to really make the point that our social determinants of health are conditions where people are born, live, work, play, and age, and worship, for that matter, that affect their health and well-being and quality of life. So really where you live and work really has a bigger impact than even having access to care or even medical care in itself. This is a nice way to sort of look at the social determinants of health. This was created by the Robert Wood Johnson Foundation and the University of Wisconsin Public Health Institute. And if you look at in the blue in the health factors, they sort of break it down, the social determinants by health behaviors, clinical care, socioeconomic factors, as well as physical environment. And you can see all those things that really contribute to those health factors, which ultimately bleeds into health outcomes, the length and quality of life. But you can also see here they weighted it by how big of an impact it has in the overall health. And they give socio and economic factors 40%. That includes education, employment, income, social support, among other things. But all of those things really have a bigger impact on health. Again, going back to that importance of really looking at the whole community when looking at population health and looking at all these other factors than just education or just on access to having that doctor or clinical care. And looking at income and employment, you can see a disproportionate impact in our communities of color in terms of median household income, rates of poverty, among other things. Similarly, housing stability, again, disproportionately impacting our communities of color on owner-occupied housing units, obviously higher in our white population compared to Black and non-Hispanic compared to Hispanic. And you can see some similar trends through renter-occupied housing and other individuals renting. This, I think, was from the Florida charts. If you are not familiar with that site, I encourage you to look at that site as well. It looks at not just the socioeconomic factors, but other health indicators, as well as a lot of great data. There's a health equity tab that you can click on, and you can see the disproportionate impacts on chronic diseases or cancers or maternal child health issues. So I encourage you, if you haven't played with that site, to visit Florida charts. So how do you tackle something like that? I think to me, it takes a multi-pronged approach. I think it needs a strategy, a comprehensive strategy as a community, and it takes multiple partners to really accomplish that. One of the important things, components to that, is making sure that the healthy choice is the easy choice. Now, as a physician, I know I talk to my colleagues all the time to get frustrated at, let's take obesity as a health concern. They talk to their patients about how to exercise more and eat less. And they get frustrated when their patients don't necessarily follow their sort of medical instructions. But I would counter that and say, are we ensuring that they do have access to those issues, things? Do they have access to healthy foods? They could be living in a food desert. Or do they have access to places to exercise? They could live in a community with poor sidewalks or not enough access to gyms and rec centers. So it's not just about making sure, in the case of obesity, to say exercise more and eat less. You need to ensure that those access is there. And as a community, I think it is important that we pay attention to that as well and try to address that, making the healthy choice the easy choice. You may have seen this health impact pyramid. As you go down the pyramid, you have a larger population impact. It starts with, on the top of the pyramid, the counseling and education. This is what we do on a day-to-day basis in the medical community, in the public health sector. Sexually transmitted infection, behavioral counseling, encouraging exercise. And then the next level down is that clinical interventions, those doctor visits, ER visits, medications. And as you go down, you have a long-lasting protective interventions. Those are more of those preventative things, such as vaccines, home modifications, smoking cessations. And going even further down is changing the context. Again, going back to that, making that healthy choice, that easy choice through policies and programs as affects the streets, complete streets concept, the smoke-free policies, housing stabilization, food deserts, and then lastly, the socioeconomic factors, systemic issues of poverty reduction and housing. So to some degree, we need to tackle each component of this pyramid comprehensively and collaboratively as a community. I did want to highlight how we're changing some of that, addressing some of those issues with health and all policies. This is a collaborative that was created and made possible by a transformative grant through the Foundation for Healthy St. Petersburg. The objective of this group was to emphasize collaborative engagement among community institutions to address community social determinants of health. The approach was developing these jurisdictional work groups, organize and utilize the health and health policies working groups within the cities of Pinellas Park, St. Petersburg, and as well as Pinellas County government to discuss solutions for local health barriers and disparities. We wanted to get that message across that everything is somewhat interconnected. These systems are interconnected. When you look at businesses, when you look at healthcare, when you look at the streets, sidewalks, transportations, they do have a huge impact. I think one of the problems that we see, we have as a community, as a society, is that we seem to put things in buckets, not realizing how one thing affects something else. So we want to get past that, and really is the best, is the only way we're going to really affect any major change and really address health equity. So you can see some of the partners in our health and health policies collaborative. I think the first thing we wanted to do was recognize what health and health policies was, and ultimately, the first thing we wanted to do was to garner the support for the various jurisdictional leaders. So we did this in the form of a resolution from Pinellas Park, Pinellas County, as well as St. Petersburg, who put both the resolution and executive order on the importance of health and health policies. Next, we developed working groups within the various jurisdictions, held kickoff meetings in the cities of St. Petersburg, Pinellas Park, and Pinellas County government to again educate on what the intent of health and health policies was, the backgrounds, and how we could move forward and integrate it within each of the departments. You can see the various work groups within the various cities as well as the county. We also created this some educational material to talk about how health impacts economic development, how it impacts transportation, public safety, hazard mitigation, as well as housing. Because again, going back to that concept of integration, of interconnectedness, I think it was important to get it out there and that we all really have a role in health. So the objective of all of this was to reduce health barriers and prevent health disparities, to prevent health dissuading environments and make the healthy choice the easier choice, and incorporate, and this is the key component for health and health policies, to incorporate health considerations in the decision-making process with the idea is that if you affect those policies and programs, it will have that trickle-down effect to our greater community. And we did this operationally by incorporating some of the health and health policy tools that were available, including a health impact assessment, which was a more comprehensive evaluation of health and health equity impacts of a proposed policy, plan, project, or program. So a very comprehensive assessment looking at all factors. It takes a lot of time and a lot of resources. So this is something that you do for somewhat of the bigger projects. We also utilize a health planning matrix, a tool designed to guide decision makings to inform collaborative feedback, using evidence-based recommendations to improve equitable health outcomes. We incorporated other tools such as Health Lens, using evidence-based qualitative assessments of various policies and plans. Health Notes, which was a more of a timely summation detailing health and equity impacts of drafted policies and plans, as well as a health consultation, which was a quick consultation, quick analysis and concise recommendations on how to incorporate health and health equity considerations. So in terms of the larger assessment, that health impact assessment, each of the jurisdictions did do a large health impact assessment. For St. Petersburg, they incorporated in the complete streets approach to 18th Avenue South. For Pinellas County government, they use it for improvement of the 62nd Avenue North roadways. And for Pinellas Park, used it in their brownfield program. But beyond those three health impact assessments, we used the other tools that I mentioned earlier. And again, really proud of the collaborative and the staff members that really were able to incorporate it within these various plans. You can see those health and all policy tools have been implemented in things like economic and workforce development, in comprehensive plans, in works, public works and development, and in terms of prioritization index. They've used it on various other things like transportation and housing, and they've done well over or close to 100 different programs and touched the programs. And hopefully for those jurisdictions involved, it really shifted culturally in terms of how they develop programs moving forward. And hopefully this work will continue beyond this grant period, and will hopefully change that culture within our various jurisdictions. I'm proud to also report that that they were recognized nationally. NACCHO is our National Association for County and City Health Officials, our main sort of national public health organization. This collaborative did play a big role in developing guidelines, a health and all policy evaluation guidance for local health departments, and our various partners were acknowledged in that document as well. This was just released about a month ago, and again, I'm really proud of the efforts of our group. Just wanted to highlight the wonderful people behind the scenes with this particular initiative. If you want more information, certainly feel free to reach out, but they've been a very energetic group that's really been able to push a lot of these initiatives and an innovative program with our health and policies here in Pinellas. And with that, I will stop my presentation and take any questions you may have.
Well, first I want to say thank you for all you're doing. It's quite a lot. I was trying to take notes as you were talking, but there's just so much to cover. First, I wanted to talk about, I really liked what you said about everyone has a role in health and being interconnected. And I'm wondering, how are you guiding people in terms of how we go back to work? Or if you have any commentary on guidelines, because so many of us have now become adjusted to a hybrid or an isolated type of space. And there are challenges depending on one's belief system or challenges or interest in getting the vaccine as we migrate back. I've been on several calls over the past couple of weeks where, some people are outright refusing to get the vaccine. And then some people are refusing to go to work with people who have not been vaccinated. And then there's just challenge again, as you noted, with misinformation about, particularly, of course, in light of Johnson & Johnson, which I happen to have received, with how people feel about getting a vaccine. I'm just wondering, are you advising at all regarding those types of policies?
I think the first thing, again, is going back to the education. What we found, both from a study standpoint as well as just reaching out to the community, what resonates is really listening or asking someone that you know and that you trust. So I think what I've been pushing is to go out there and ask someone that's got the vaccine as to how they came to that decision. So I think that's important. from a policy standpoint, it could be a little difficult. Some of the challenges I understand is that it hasn't received, and usually they wait for about a year to get the full FDA approval. Currently it's under emergency use authorization. So some of the legal concerns I think I've heard is that it's hard to make something mandatory if it's still under that EUA. I think for the time being, the best thing to do is try to continue to educate as much as we can. From my standpoint, I can tell you just from a personal note, I got the vaccine early on. I'm waiting for the Pfizer to be approved for less than 12 so I can give it to my son. I think it's important out there. I think this is the only way in my mind to get past the pandemic. It's the only way to ensure that we don't see these future outbreaks. So.
And you mentioned 9,200, I believe, different variants. So that causes a lot of concern for people who don't really understand how that's going to impact us. I'm wondering, what are we advising also? You mentioned your son, 12 and under, but what about that teen population, that window between 12, 15? Are we at the point where we're advising people in that age group to get a vaccine? And if not, when do you think we'll progress to that level?
Okay, so currently the vaccine is approved for those under the age of, up to the age of 16, at least for the Pfizer. Right now, Pfizer's looking for approval between the ages of 12 to 15. Hopefully in the next month, they will get it. I think some of the challenges that we see with our young folks is that the concept that I guess when you're young, you feel indestructible. And what studies have shown, it's the older individuals do have more of the severe outcomes. So I think that's a less of a motivator for them to get the vaccine. Again, I think it goes back to education. I was never afraid if I ever got COVID, just because I know the statistics, that I wouldn't have the severe outcome. My biggest fear was that I would unknowingly spread it to someone that I love, someone that was vulnerable, my mother that's older than the age of 70, that could have potentially that severe outcome. So the best way to prevent that and to give that kind of reassurance is to make sure you get the vaccine. And while that it's not 100%, the more people get it in our community, that Swiss cheese model, that we can provide that level of protection, that herd immunity.
I fell in that category too of, wondering, even if I've protected myself and tried to remain healthy. Number one, I lost someone very close to me early on. And secondly, I'm around people who have vulnerable issues. So, and people, when I talk to them, even if they've had COVID, they sort of, if they've survived it, may feel a little bit invincible. But then there are some people who have these lingering symptoms. Can you speak to that at all? And do you have any statistics about that?
I think we're learning more about these, what we call these long haulers. So I've spoken to a number of colleagues that treats the long haulers, and they're seeing that more and more, that lingering type of impact. In fact, there was a sort of a big study that was released about a month ago that does show that up to 1/3 of individuals that survive COVID, whether they had mild symptoms or not, develop both mental and neurologic health issues and disorders past 6 months of recovery. So the concern that I have is that, again, we are continuing to learn about COVID-19. It is a novel virus, and the long-term effects, I don't know if we'll fully get that picture, but there is certainly evidence out there that more and more people are developing these long-term, long hauler sort of syndromes.
And so for those individuals, are they still advised to get vaccines?
Yes. So those that even have COVID, they do recommend you still get the vaccine by the CDC. One of the reasons is that if you've had a mild form, for example, of COVID, you don't know exactly how long the antibodies are going to last. If you had a mild symptoms, you may actually have a smaller antibody response, whereas the vaccine gives you a steady response or a consistent response. So again, anyone that's had COVID, I would recommend getting the vaccines as well.
Okay. And in the future, will anyone have to update their vaccines? There's this information out there too that I'll have to get it again. Is there any information about, once you've been vaccinated, are you covered?
No, unfortunately, they just don't have, it is a new vaccine. We don't know, like even for the pertussis vaccine that's been around for decades, we just discovered just, I don't know, it's probably been a few years now, but that they do require a booster later on down the road. And similarly, I think we're going to see the same thing as we learn more and do the antibody tests like 6 months from now, what is the longevity there. But more likely, if I had to guess, it will probably require a booster. Hopefully not annually and maybe a little further out, but there is a chance we could, like the flu vaccine, get it annually.
And that would be for all the different types of vaccines that are currently on the market?
Possibly, yes.
Okay. And then you talked about homelessness in the elderly. What about our veterans? And I don't know if you have information on how we're tracking them, how they're responding, if there's anything specific that we're doing in terms of what you could be described also as a vulnerable population, as you talked about, that we all have a role in our health and interconnectivity and helping to make sure that we all reach this certain percentage in the county.
Yes, the VA program has been a pretty great partner. They've been offering free vaccines to anyone that's eligible and their families for a little bit of time. Those numbers unfortunately don't get counted, and we're working with the state on trying to integrate it into our vaccine numbers. But we've been talking to them pretty regularly, the VA Bay Pines as well as the VA in Tampa. And together, they've done over 15,000 of our Pinellas County residents. So the numbers that I read off earlier with the percentages, we need to add the 15,000 other individuals that the VA vaccinated. So it is important. And again, they've been a great partner.
Have you partnered with nonprofits? I noticed that you have a ton of partners, that were noted throughout your presentations, but have you specifically worked with nonprofits who may have a niche in the community to reach to more vulnerable populations?
Yes, through our various initiatives, most notably our Health Equity Initiative, we have a number of nonprofits out there. The foundation has been a great partner on that as well, really getting that information out there. But yes, we've been working with them. But certainly, I think anyone that can relay the importance of getting that vaccine and really continue to push that message, I think is important.
I want to encourage our participants to put questions in the chat as we try to finalize within the next 5 minutes. And I see there is one question from the chat, and I don't know if you can see it also, but I'm going to spell it and not try to pronounce it. It says, have you heard of levermectin, L-V-E-R-M-E-C-T-I-N? And if so, what is your thought? I hope I didn't butcher that too bad.
So they're studying that right now. It's pronounced ivermectin. It's an antiparasitic.
Thank you.
They are studying that. A lot of oral pill options. I think that's what they're looking for. There's nothing definitive right now. I follow the Infectious Disease Society Society of America's guidelines on that, and right now I believe their guidelines specific for ivermectin is that only do it in the setting of a study. There just isn't a lot of evidence-based medicine. Remember our early on with the pandemic, the hydroxychloroquine, they thought it was an effective medication when subsequent studies showed that it was not the case. So it's important to use evidence-based medicine on some of that. Of note, I know a lot of people are looking for a pill option. Pfizer, there is a promising a pill right now. I think Pfizer's developing and trying to study right now that I'm optimistic it's going to be hopefully like a Tamiflu type of pill for COVID-19. But again, those studies are ongoing.
Okay. There's another question in the chat, and it's how prevalent is and you're going to have to help me with some of these pronunciations, herpes zoster, Z-O-S-T-O-R side effect for the Pfizer and blood clots for J&J?
So the herpes zoster side effect, that's shingles. So for the shingles reactivation, I've heard of a little bit. I'm not sure how prevalent that is. We do have a VAERS system. That's a vaccine adverse events reporting system. I'll take a look and see what kind of numbers that we're looking at. I know that can happen with any vaccines, but in terms of the prevalence, it's hard to tell. In terms of blood clots, the blood clots. What the blood clots in terms of the prevalence? What was unique about the Johnson & Johnson's blood clots? It was a different, unique type of mechanism, but again, very, very rare. You probably saw that for the Johnson & Johnson, there was only 6, but I think it's become 15. So 15 out of the 8 or 7 million people that did receive the Johnson & Johnson. And again, the FDA advisory group did look at it very closely, and they again deemed that the benefits outweighed the risk, with that warning and caveat to look for those types of symptoms. But keep in mind that COVID-19, if you remember early on, that it is a disease where you can actually develop a lot of clots. And some of the studies actually showed that if you were to get natural infections, your risk is so much higher of getting those clots rather than any of the clots developed from the vaccines.
Thank you. We're going to take one more question before we wrap up, because I'm trying to keep us on time since we have such a strong schedule today. And the last question is, do you encourage folks who have been vaccinated to report reactions that are already known to be common, for example, fatigue or swollen lymph nodes?
I think the more data points, the better. There's ways to sort of decipher and sift through some of that. But if you feel, I would encourage you to do that. I think that gives us that more information just moving forward on various common side effects that can be seen with the vaccines.
We didn't have time to fully flesh out the second portion of your presentation, but I wanted to give you time, now that you're not actively in the presentation, to say anything you would like to comment as final words for health determinants and what we're doing to work on that in the community. I thought your presentations that show the interconnectivity issues that contribute to health inequity and challenges, particularly since we're in our Social Justice Institute forum today, are important. And so as you wrap up, if you'll comment on what you think we can do better as a community, particularly in Pinellas, to address it so that we all reach that percentage that we need to protect ourselves from this pandemic.
Okay. Well, I'll start with the COVID-19. One thing I'm sort of pleased to see is with COVID-19, I think people notice the disparities, the inequities that we were seeing, the disproportionate impacts on our communities of color, as well as with the vaccine rollout. So I'm glad that that's been highlighted. But again, it speaks to larger issues of social determinants, the disparities out there, social justice issues out there. And I would encourage those that have noticed those disparities, COVID-19, to work on other initiatives that pertain to health equity. Like, for example, we've had ongoing initiatives with and the HIV epidemic, where last year our new cases, 32% of our new cases were from our African-American community, and our mortality rates. We have all these initiatives going on. So I encourage everyone to get involved and participate in the various health equity initiatives that are out there. It does take a collaborative approach, and from the Institute standpoint, I think it does take a comprehensive sort of strategic plan. How do we best get to that point?
For your time and for your patience, and for sharing this such important information about how we understand COVID, how we engage with each other, and how we rely on medical and important science to get us through it. And I can't thank you enough for your time and your preparation. You have been working with us for quite some time, and I've seen you all around the county doing the good work of informing people, and we're grateful for your service to our community. So thank you so much.